We have a couple of guests I'd like to introduce you to today. First of all, a physician, Dr. Paul Ehrmann. He's a Royal Oak physician, and he has been for the past 30 years. He's serving as medical director for a busy practice. He also has been an advocate for healthcare since 1994. He's built one of the largest private patient coalitions in the state of Michigan for physicians. He's continuing to fight for improved access, affordability, and quality health care for all patients. We all want that very same thing. It's just how we go about it. He's a free market capitalist like most of us here today.
Yeah.
He's got a different way to do it.
Thank you, everybody. I wanted to thank, first of all, thank Glenn Clark for organizing this rally. Let's hear it for Glenn.
Closer.
I wanted to again welcome our fellow Town Hall Un-Americans and evilmongers, and also our rabble-rousers. My name's Paul Ehrmann. I'm a physician, and I'm not a member of the American Medical Association. A little-known fact is only about 17% of physicians in this country are members of the AMA, and I do not support their position on health care reform. There are hundreds of thousands of physicians in the country that feel the same way I do, the same way you do. And you can't hear me? Okay, I'm sorry. Okay, I'm trying. Can you hear me better now? I'm trying to...
There you go.
Okay, right here. Okay.
Yell it out.
All right. There are thousands of docs in the country and millions of people across this great country of ours that feel the same way, and that's the reason I'm here today. The Mayo Clinic said of House Bill 3200, quote, "It misses the opportunity to create higher quality, more affordable health care for patients. In fact, it may do the opposite. In general, the proposals under discussion are not patient-focused or results-oriented, and the real losers will be the citizens of the United States," unquote. Cleveland Clinic CEO Dr. E. Cosgrove has said the bill would make the problems with health care substantially worse, and in the Wall Street Journal at the end of July said that House Bill 3200 and the related legislation is the worst piece of legislation ever to come out of Congress. There are many pieces within this bill that has a real potential to make it to the President's desk, regardless what is pulled out at this point in time. However, if it passes in any form, it is the people that will be in charge of administering this legislation that is the most worrisome to the future of your health and that of your family, especially to our seniors. Let me just give you one example. An influential member of the committee who will write regulations for whether you can receive medical procedures, known as the Federal Council on Comparative Effectiveness and Research, has said, quote, that in order to save money, doctors will require to change the way they think about their patients. They take the Hippocratic Oath too seriously. They're taught that it is imperative to do everything for the patient, regardless of the effect that it has on others, unquote. So it appears that we as physicians will be civil servants directed to withhold care for the common good. What do you think about that? Boo! That's what I thought. As a physician, I'm sickened by this as well. When I took my oath as a physician, I promised to practice my profession with conscience and dignity, with the health of my patient always first and foremost being my first consideration.
Yeah! Let's hear it.
We should urge our elected officials that in this kind of language that promises to be pervasive in many sections of the final bill is unacceptable. Our children and our grandchildren owe our parents and grandparents more than this. Our greatest generation, many immigrating to this country to fight for a better life for us, our veterans fighting and dying in service to their country. We are told to withhold services for them because it is not cost effective. We should never allow our government to control our life.
Never.
Once the door is open, you'll not be able to close it. This decision should be between you and your personal physician.
Yes! Yes!
If we let this administration take over 1/6 of our economy, the largest power grab in the history of this country, this is what we have to look forward to. So what can we do? The town halls will be over soon. Our work will become even more challenging. But I'm here to tell you today, just like I did in 1994, that we can make a difference.
Yeah.
We will make a difference.
We need to continue to stay actively engaged now more than ever, educate, advocate, and spread the word of our message to our elected officials, particularly Congressman Gary Peters and his friends of like kind in the U.S. House and Senate. We too want health care reform for our imperfect present system, for the 5% of naturalized Americans that cannot afford a basic level of health care that improves patient access, affordability, and quality. However, it is abundantly clear that the majority of Americans want the engine of this reform not to be in the form of a government takeover and dismantling of our present system. A system that provides for 95% of our population, but rather it should be in the form of improvement in tax, insurance, and tort reform, with decision-making about the life and death being determined by you and your physician.
Yes!
For those of you who support this confusing bill, the repackaging effort changes every week in reaction to the poll numbers in order to sway Americans who are now undecided. Health care, health insurance, public option, co-ops, you'll be able to keep your doctor, more benefits, less cost, tastes great, less filling, or whatever. From the majority of Americans, this will not convince them. We're on to them. If it looks like a duck, walks like a duck, it's a duck. From the start, our message has been simple and on target. We do not want government-controlled health care.
No! No!
What started out as an honorable effort of meaningful health care reform has deteriorated into a political solution of more government control of its people. We cannot let this happen.
No.
In the coming weeks, our elected officials will attempt to give us health care reform, even if we want it or not, by passing any form of legislation that may not have a majority in the House or Senate. Make no mistake, regardless of its final version, if it happens, it opens the door to their stated intent, an incremental, single-payer, Canadian-style health care system down the road for you and your family. We should also insist that those who support these bills also sign up for the same in House Bill number 615 and forego their present private insurance. I hope members of Congress, particularly those in the Senate Finance Committee, that are negotiating for passage of this legislation, namely Senators Grassley, Enzi, Snow, Collins, Graham, and Bennett, will not misjudge the American people again and their resolve of their constituents, especially our seniors, which have the most to lose. We need to remain passionate and engaged and demonstrate daily democracy in action as we continue to fight for control of our lives and the lives of our family. Finally, write, email, call, and rally with the clear message that our elected officials work for us. And if they pass this in any form that is unacceptable against our will, they can start looking for another job when they are voted out next
Kill the bill! Kill the bill! Kill the bill! Kill the bill!
Thank you, Dr.
Kill the
Ehrmann.
bill!
What is it about what Obama said when he said, we've all seen the video of him saying, I'd like to see a single-payer system in this country? What is it about that people don't believe? That's what he wants. This bill, where is it? Right here. H.R. 3200. 2 days to print it out alone. Let alone read it. I have read a little part of it. I have read